Your midwife will meet you and discuss your birth preferences and assess your stage of labour. This will help determine what type of pain relief is most appropriate for you at this time. So pethidine is an opiate similar to morphine, and it's given by injection into your thigh. It can make you feel a little bit nauseous, so we would always give you an antiemetic or an anti-sickness injection at the same time. It's very helpful in the early stages of your labour, and it can relieve a lot of the intensity in your contractions. It can make some mums feel a little bit drowsy, but sometimes this can be just enough to allow you to rest and relax between the contractions and allow your labour to continue throughout. Pethidine can also make your baby a little bit sleepy. And so for this reason, we would be reluctant to give you pethidine if we felt that your baby's arrival was imminent. Here in the CUMH, we have gas and air available in all of our birthing rooms. Also known as Entonox, it's a mixture of nitrous oxide and oxygen. It's a short-acting drug and it has no effect on your baby. And it is perfectly safe to take this if you've already had some pethidine. The drug itself is self-administered through a mouthpiece and tubing, and it takes just a few seconds to take effect. Your midwife will encourage you to take a deep breath through the mouthpiece at the start of your contraction and then exhale slowly. You continue to breathe like this until the pain has passed. One of the advantages of using gas and air in your labour is the technique is the same as you would have used in your breathing techniques for the earlier part of your labour. The tubing for the gas and air is long, so you'll still be able to mobilise around the room, you'll be able to use your birthing ball, change positions and generally mobilise to where you find yourself most comfortable. Gas and air is also available in the birthing pool. An epidural is another form of pain relief that is also available to you here in our birthing suite. This is a procedure that's performed by an anaesthetist, and should you decide to have an epidural, the anaesthetist will come and explain and discuss this procedure with you prior to commencing it. An epidural is where a small tube is inserted into the small of your back. Through this tube, a local anaesthetic is inserted by the anaesthetist, and this local anaesthetic numbs the nerves that carry the signals to the part of the body that feels pain. Most women will find that an epidural is a very effective form of pain relief in their labour. However, it does make changing position very difficult in labour, and it is not possible to mobilise any further. Throughout the rest of your labour, you will require to have continuous monitoring of the baby because there's a continuous infusion, and observations will need to be carried out. A urinary catheter will be inserted and IV fluids will be required also. An epidural will mean that you are confined to your bed for a good 6 hours after your baby is born. It is important to remember though that in any of your choices regarding your pain relief, your midwife is there to support you and help you make the appropriate decision. Here in Cork University Maternity Hospital, we also have a birthing pool. At present, we do not conduct water births and request that you would exit the pool prior to your baby's birth. Water immersion has been found to be very useful in managing pain in labour. The warm water helps to relax the muscles between contractions, and also the water supports and makes moving and changing position much easier. There is evidence to suggest that the use of water in labour leads to shorter labours. However, your midwife would not recommend the use of the pool if you have had a pethidine injection in the preceding 4 hours. However, gas and air is available. The pool is available for all women that are experiencing a low-risk pregnancy, and your midwife will assess your suitability for the pool prior to entering it.